Hi, I'm Dr. Adolph Lombardi of Joint Implant Surgeons, and I'd like to talk to you today about hip disease. You know, many patients come to see us with disabling hip disease. The hip disease is caused most of the time by osteoarthritis. Now, osteo means bone and arthritis means that there's inflammation of the joint. So hip arthritis, there's inflammation of the hip joint. There's loss of that smooth, shiny cartilage. Let me show you a picture of what I'm talking about. So if you look at this picture, you see the normal hip. The normal hip has a cartilage lining on the socket or acetabular side that's in your pelvis, and on the femoral head or the ball side that's in your thigh bone. And that cartilage thickness is what gives you that smooth motion. With the development of osteoarthritis, you lose that cartilage layer, and the body reacts by forming these bone spurs. And you figure this out because all of a sudden it becomes difficult to get in and out of the car, ascend and descend stairs, tie your shoes or put socks on. And so when patients come to us with this type of disease pattern, we generally recommend that they consider having a hip replacement. Now, in performing a hip replacement, we remove the disease ball right at that level there. So we remove the ball there and we clean out the socket. And then we give the patient a new ball and socket mechanism. And so if we look at this picture I'm going to show you, it'll show you what an implanted hip looks like. The metal rod is secured into the thigh bone. A metal or ceramic ball is secured then onto the metal rod. And a metal shell is secured into your pelvis or where your socket was. And a plastic liner is placed in there. Now I'm going to show you the actual material. And this is the actual material. This is an example of a femoral stem. This stem is inserted into your bone. It's got a roughened surface to allow the bone to grow in and attach to it. Then on top of this metal stem, we can put either this pink ceramic ball or we can use a metal ball like this. Now on the socket side, we put a metal shell in, and this is already assembled, the metal shell with the plastic liner. And then once we have the metal shell and the plastic liner up into your pelvis and socket, and then we have the ball and stem here, that's how we reconstruct your motion. Now today we also wanted to talk to you about how does this get implanted. And there are a number of ways it can be implanted. You can put this implant in from the front, from the side, and from the back of the hip. We have chosen to do the majority of our hips from the front. This is called a direct anterior approach. Now, the reason we do the direct anterior approach is that you can actually access the hip without cutting any muscle between two nervous planes, which means we're not affecting any nerves, any muscle, and when we put the implant in this type of fashion, the recovery is extremely speedy. Typically, it'll take us approximately 1 hour to do the operation. And then the patients are out of bed literally within hours of that operation, walking, full weight bearing. And then they can go home actually later that day. Or some patients go home the next morning. But today, a majority of our patients are going home the day of the operation. They can walk with a walker. They can gradually wean themselves off of a walker onto a cane in a matter of weeks. And so what we're seeing is a more rapid return of function based on what we call the direct anterior approach or the anterior supine intermuscular approach. There are other approaches sometimes that need to be performed, such as what we call a direct lateral approach. This may be an approach we use more frequently, for example, for a redo operation. But in majority, as I said, of our first-time surgeries, the direct anterior approach will allow that speedy recovery that we're all looking for. So come visit us at Joint Implant Surgeons. We can assess your hip disease, we can determine if you're a candidate for a hip replacement, and we can work together with you to develop the appropriate plan.